to the Wild Wisdom Podcast with Dr. Patricia Mills. I'm Dr. Patricia. This podcast is for people who want to transform their health, restore their hormones, and reconnect to their body's natural wisdom. Hi, I'm Dr. Patricia. I'm a Canadian medical doctor, published author, internationally recognized researcher, and passionate advocate for your health. Here, we'll explore the intersection between ancient wisdom and cutting-edge science, distilling the essence of true health into practical steps you can take. Wild wisdom is instinctive knowledge in action. Thanks for making this part of your day. Traditional Western medicine has specialties that range across acute care all the way to chronic care. And it certainly divides itself into body parts. So like there's the cardiologist, the urologist, which is bladder system, primarily the nephrologist, which is the kidney system, the gastroenterologist, and then there's the internal medicine, which is you start off with all of those internal organs, and then you can decide if you stay generalized or if you go further into cardiology, nephrology, that kind of thing. And then there's neurosurgery. So there's the brain, neurology, the brain, but not the surgery. And so there's these silos, right? And it's very, and you can stay within your area and not kind of venture beyond that. However, to be a functional medicine doctor, you have to cross all realms, because the cause of disease can originate with one or more causes, and it affects all realms. If you have, for example, let's say stress as your cause, like you have a lot of stress in your life, unmitigated stress, you haven't learned how to deal with it. And so your body's having to mount a daily reaction to stress. That'll cause your adrenal glands to have to go up in its function to create more of those stress hormones. That then affects your thyroid gland, right? And your thyroid gland creates, is basically the general of energy for all of your organs, which then will affect the brain, which will affect the gut, which will affect the ovaries. And then the ovaries in turn affect the thyroid. So there's this like cascade of interrelated events, right? Interconnected systems. And so a functional medicine doctor basically has to not be in one area, like, kidneys or cardiology. They have to look at the big picture. And they could deal with acute care, but they're more often, so to speak, in the prevention of disease and then the management and reversal of chronic and sometimes acute conditions. But when I say acute, it's not necessarily surgery, or like an acute poisoning event with drinking like the wrong, kids drinking like something, from underneath the sink that they shouldn't have. But they could deal with like, a mold toxicity or like a Lyme infection, which would be it can be like an acute issue, but it can also turn into a chronic issue. And oftentimes, unless you're really lucky, usually you get to be seen by a functional medicine doctor if you even get the chance to, when the condition is more chronic. There are some people who are already really connected and really aware, and they will go to a functional medicine doctor right away. And so they can get on top of it faster, for example. Now, and I keep saying doctor, but, functional medicine practitioner, because anyone who's part of or an organizing body, so like chiropractors and naturopathic doctors and pharmacists, they can go through the functional medicine training and become a functional medicine practitioner in their field. And dentists, you can have functional medicine dentists, and usually they call themselves biological dentists. So like they look at, as I was saying with Dr. Weston Price, it's a whole body event that affects your teeth as one of the downstream effects. So when you see problems in the teeth, you have to think about what's going on in the whole body, right? So you can be a functional medicine practitioner in terms of the way that you approach your practice. And then you can become certified additionally. So you can be a functional medicine practitioner and by virtue of self-educating around root causes and looking into the literature and following people who practice functional medicine and teach it and self-educating that way. And then you can become certified through an institution where you do a certain amount of modules and courses, and then you have to write an exam and pass the exam, and then you get a certification. Okay, so that's something that can be done Yeah, when you speak about Western medicine and functional medicine, you can't separate them because there's actually quite a bit of overlap. And I mean, I've met some Western medicine doctors who, whether they know it or not, had a little bit of a functional medicine mentality, and they did a little bit more research. And so they're a little bit more inclined to, try different things out with their patients and do a little bit more investigating and kind of like are willing to try different things out according to what's been published in the research more recently, and go outside of their residency training or the what their colleagues are normally doing, like a little bit beyond, so that you can get that. And then there are functional medicine doctors practitioners who are doctors, so they had the Western medicine training, and they continue to use their training to help people with the short-term feeling okay. Like, for example, some people who have fungal overgrowth in the bowels, they might need a short course of an antifungal medication. So they get that prescription, which a Western medicine doctor can provide. Interestingly, though, however, the difference between a Western medicine doctor and the functional medicine doctor in that case is that Western medicine doctor might not even think to look for that. They might not even be aware that that could be an issue, and that is a problem, and that people have that, and that when they have that, this is the way they present with these symptoms, bloating and gas and all these like weird skin and hair infections and that kind of thing. So it's hard to tease them out. Like, you can't fully separate them out. However, if I were to get sick, my dream doctor would be someone who trained in Western medicine and then went on to do functional medicine training, and then didn't even stop at functional medicine. They stayed curious and they looked into the research. Like, someone comes up with an issue and they go, okay, I'm going to also spend about 20 minutes to look up your specific thing that you're coming to me with, to see if there's anything else. And I'm going to see if there's anything that's Ayurveda or traditional Chinese or, whatever. And so long as it meets my criteria for it being like, it makes sense in terms of what I understand about the human physiology, and there's some evidence of safety, and it's the burden of like risk is low, right? And the cost is low, and the patient's willing to try it. If what we've been doing hasn't been working, because the reality is that there are cases where functional medicine doctors just cannot figure out with the training that they have. And what I would want is a doctor who stays curious and doesn't just drop the towel and say, I've done everything I can, that's the only thing I can do. They should either refer to someone else who they think has a different skill set that they think could be of service, or expand their own skill set. This is what I try to do in my practice, is that I'm always looking up and trying to find new solutions and find other ways to do things if what I'm doing isn't working. And I partner with specific people when I see certain issues popping up that I know, and these people are really good at what they do in these very niche kind of areas. And then, they help out with that niche concern and issue. So I think the doctor of the future is going to be a Renaissance doctor in that way. And so far, functional medicine doctors and practitioners seem to be the closest thing to it. Thank you for taking the time to listen to this podcast, Wild Wisdom with Dr. Patricia Mills. If you like this podcast, please take the time to like and subscribe, and please feel free to leave any comments and look below for the contact information if you want to connect with me directly. Thank you, and I hope you have a wonderful day, evening, or night.
Hi everyone, I hope you enjoyed this episode. Just a reminder, this podcast is for educational purposes only. This podcast is not a substitute for a professional care doctor or other qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or other professional advice or services. If you are looking for help in your journey, it is important that you seek out a qualified health practitioner. If you would like to work with Dr. Patricia for her expert health transformation guidance, please email her at info@drpatriciamills.com to book a discovery call. You can also find Dr. Patricia on Instagram at Dr. Patricia Mills and Facebook at Wild Wisdom for Women with Dr. Patricia Mills, MD. For access to all of Dr. Patricia's educational videos and more amazing perks, consider becoming a Patreon member. Links are in the description of this episode. It is important to have an expert in your corner that can help you make the changes you crave, especially when it comes to your health.